Good evening, everyone. My name is Juliet Jones, and you are watching the Focus on Sexual Health. And I am a case manager and a HIV and hepatitis tester at Universal Family Connection. And this is a live talk show, so please call in. You also can catch us on the online, so we can take questions. The number is at the bottom of your screen. It's 312-738-1060. My name is Juliet Jones. I work for Universal Family Connection. I'm just going to take you to our website. So we're located at 1350 West 103rd Street. We have two offices, one in the Beverly area, and then we also have one on 79th Street. And we also, just get this out the way, we also have HIV support groups. So I want to get this out the way because it's going to be a great show tonight. We have an HIV support group, and we wanted to give our support group like ownership, make it something that they can say, I'm going to rise. And so that's what our CAB members came up with, RISE, R-I-S-E, renew, inspire, support, and educate. Our support group is every Friday from 10 a.m. to 2 p.m. and there's refreshments being served. So once again, my name is Juliet Jones, and you could call me at 773-881-1711. Extension is 1156. That is our office number. We also have another support group. This is the first and second Thursdays, and this is up north. So once again, let me take you to the overhead to show you. And it's called Rise 2. Renew, Inspire, Support, and Educate. This is another support group. It's every first and third Thursday of each month, and it's from 12 to 2 p.m. It's located 1020 West Bryn Mawr Avenue in Chicago, Illinois. So, support groups are very important, and like I said, you learn a lot, and there's people that come to the table like yourself, so it's like-minded, and it tells you about resources, and you can also facilitate at the support group. So I need you to please call me at the 773-881-1711 extension 1156 number, so you can take part and be a part of our RISE group. Please do that. I do HIV testing and hepatitis testing. So once again, please reach out to me and give me a call, and you can even contact me through our website as well. Give me a call and I can bring the testing to you. Sometimes people don't want to come into the office because we're located on 103rd and Vincennes. Well, I can come to you. Yeah, my license tells me that I can meet the client where they are. So feel free to give me a call. And also, I wanted to inform you about Universal is a full-fledged social service agency. So we have an array of program and services to meet the family needs. So you're all about the family, and so that's important for you to go through our website and find out. We also, I want to mention, we also have a youth program. This is a new program. It's called the Community-Based Violence Intervention and Prevention Program. So it's not just about there's a youth involved in violence. No, it's about intervening and giving them the tools, the education that comes with, and the resources to prevent such violence. You can prevent, but then if they didn't get the resources that they needed, so they won't have to go back on that corner or that spot where the violence took place. And so that's why that prevention part is important as well. So it's about interrupting and preventing with those resources. And they focus on 4 core areas. So they get case management, they get counseling, and they get youth development, and street level intervention and prevention. And the ages is from 6 to 24. So if you want to know more about that program, also reach out to Universal Family Connection at 773-881-1711, and the extension is 1175 for that youth department. So thank you. So let's get into our program. The title of our program tonight is called HIV Treatment. So this is about the basics. So just to get you familiar with, if a person has tested positive for HIV, they have to go on treatment. That is advised to go on treatment. Treatment helps span their life. So treatment is important. You know, HIV is not there's no known cure, but there's treatment. So let me just walk through the process of someone that tests positive. If someone is engaged in unprotected sex or doing intravenous drug use, then they are at risk. That is the behavior for someone to be at risk for HIV. And unprotected sex could be the oral, vaginal, or anal sex. And then the intravenous drug using. That is the behavior that put a person at risk of being HIV. So I'm going to walk through the process if someone did come in and they did test HIV positive. You know, I would give them the time to think about what I just informed them that the test was positive. So I would give them that quiet moment that they have. And if they need counseling, then Universal Family Connection does have a licensed counselor for that. And during that counseling process, that counselor would make sure they have a support mechanism. You know, the first one would be that counselor, but then it also would be talking to that individual who came in to get tested. What about your family support? Now, it's not about disclosing right now to that family support. No, it's about that family support that can probably come to that place to pick them up. Because now they don't want to drive themselves, or they don't want to get on the bus, being in the public. So that family support is so important right there when that person is diagnosed. Is diagnosed. So that's why that counselor would make sure, and myself too, I would make sure they have that support in place. It could be family and friends. Remember, it's not about disclosing yet. It could be children, you know, and so when it comes to that point of disclosure, well, then there's materials, there's education, not just materials to read, there's education on how to work out, how would you disclose. So, you know, there's training on disclosing, and so that's important too for that person who tests positive. And then also the referral must be done within 24 hours to a medical doctor for the treatment, because remember I said treatment is important for someone who tests HIV positive. So even though I'm going through my HIV treatment, I'm going through the program, but please feel free to call in at 312-738-1060 with your questions or comments. And so to add on to it, I want you to add on to it because you may know something that I don't know. And so that's what we're all here for, to learn. So please call in. You don't even have to give your name. Just call in with your questions or comment. So for the treatment, this is how the treatment for someone who tests positive for HIV would look like. The test result, like I said, come back HIV positive, and then we have to do a confirmatory test. That takes about a week to get the results now. It used to be a long time, but not anymore now. They can get the results back within a week of that confirmatory test. And so the doctor will give them that diagnosis, and they will have to be followed by a doctor every 3 to 4 months for their care. And their care, as I said, would be going to the doctor and getting their blood drawn. And the series of blood tests would be to detect the amount of the virus, the viral load that's in the person's body. So the doctor will look at the viral load test and look at the CD4. The CD4 is a cell. So we all have red cells and white cells, but someone HIV positive, they develop the CD4 cells is what the doctor will look at to determine the amount of their CD4 count. Probably heard it like that. Or some people say T cells. You may have heard it like that. And so I'm just going to give you a range of a healthy person's CD4 count. It would probably be from 800 to 1200. A baby has more T cells because they're more healthier. Think about it. The baby was just born into the world. So from that 800 to that 1200 would be the healthy T cells. So if someone tests positive, and it also depends on when they were infected. Just because they came in for a test today doesn't mean that was their first time of being exposed. It could be, remember they had that dormant period, it could be 10 years. So we think about that. So if they came in and they had their test results today, and then the doctor would, like I said, assess their white cells, the amount of white cells. And so usually it fell out of the healthy range. So just say it may be 600. And so then that's when the doctor may, talk to the patient. Hey, it's time to start HIV treatment. And what does treatment look like? So I'm going to spell out for treatment. Now, this is for the patient to decide if they're ready. They're ready to take medicine every day. That's what the treatment is. You have to take medicine every day. So there's some key points to remember. The medicine is called antiretroviral therapy. You probably already heard of it as highly active antiretroviral therapy. Well, that's just a class of HIV medicines that treats HIV infection. And it has to come in a combination. Back in the day, you heard people was taking 10 pills, 10 pills, 12 pills, 5 pills, and then been reduced to 4 pills, 3 pills, 2 pills. Well, now they have one. They have one pill, but it's in a combination. So that one pill can hold 2 or 3 classes of drugs. It can hold 2, 3, 4, 5 classes of drugs. So it varies. But one pill now, which is a person can be more adherent to that one pill than 10 pills, right, a day. So they have to take the medicine every day, so they have to be adherent. So when they're taking the medicine, how does HIV medicine work? So when they're taking the medicine, that medicine can help reduce the viral load. Remember, the blood test that the doctor would look at would be the viral load, and the viral load is just the amount of virus contained in the body. If this was the mechanism to detect how much blood in there, that means that they would measure a pinch of blood to see how much viral load. And so that's what the doctor would assess. And then they will look at the CD4 cells or the T cells to determine if it's a high range. Remember I said 600, right? And so that's when they determine it's time for HIV medicine. So when a person is tested HIV positive and they decide, okay, I do want the treatment, they will take the pill, whether it's one pill or a combination of 2, 3, 4, and 5 pills. And so they will have to take that medicine every day for it to work with the immune system. So that's why it's important for a person to take the medicine, because the virus itself multiplies within the cells. So, I would like to pull up a diagram. I think for a future show, I would like to for you to see how the cells can multiply, the HIV cells multiply to the healthy cells. So I am going to try to get a video of that to show that. I think that's important, something different, a different way of looking at what happens when someone swallows an HIV meds. So it is important, and you can get that education piece at Universal Family Connection. We can show it through our support groups as well. So when they're taking their medicine, the medicine is focusing on the viral load. They're trying to get that viral load down to non-detected. And when there's a non-detected viral load, that means that person is less effective to transmit the HIV infection through an unprotected sex or intravenous drug use. So remember, I'm going to say it again. So if a person is taking their HIV medicine every day and they are able to achieve that undetectable level, that means that medicine did work to get that viral load down out of it. So the immune system became more healthier now. It became to an undetectable level. That means they cannot transmit or infect someone through unprotected sex or intravenous drug use. And then also there's another preventive measure out there. It's called U equals U. I'll get into that later. But also the medicine also works to increase the CD4 count or the T cells. The T cells are your helper cells. So once the HIV medicine enters your immune system and it get into the CD4 or the T cell, it's helping to boost your immune system. So remember I said it was 600. That's when a person decided they was ready to take their HIV meds. They was ready for treatment. And so now they're taking the medicine every day, and then when they go back in that 3 months or that 6 months, and the doctor's going to look at that and see that their CD4 count increase. Now, I've been in this business for 20 years, and I have seen, I've worked in a clinic, so I've seen patients, and I worked in the social service area like I'm working now, so I've seen clients. I've seen their CD4 count or the T cells went from 0, which is an AIDS diagnosis. I've seen it come up to 200, which is still an AIDS diagnosis. I've seen it go to 600. I've seen it go to 800. I've seen it go to 900 and even 1,000 or even 12. Back to that healthy state. Remember, I initially said about 1,200 would be the healthy CD4 cells. And so with treatment, yes, a person's immune system can get better, much better on treatment, and they have to be adherent to their medications. Now, I know there's barriers to taking medicine, but it is important to take your medicine every day. And then there's a preventive measure. If a person was undetected, there's a benefit. Now they can engage in, and I'm not condoning having unprotected sex just because you achieve the undetectable viral load, but the preventive measure is U equals U. It means that undetected mean that you cannot transmit. You're not able to transmit the virus. So that's a benefit to someone who's taking the medicine every day. Then they can relax, because it takes away the shame of them thinking that they were so highly infectious that no one wants to be with them. They can't have sex. They're fearing transmission. So it is a benefit to taking your medicine every day. Of course, it builds up your immune system. We know that great benefit, right? It gives you a new outlook on life. So there's great benefits. Now, with every medicine, there's always a side effect. But that side effect, keep in mind, the benefit of taking your medicine every day outweighs the side effects. And some of the side effects, would be diarrhea. It would be maybe skin lesions or an allergic reaction to the medicine. All medicines is heavy on your liver and your kidney. And so, we have to understand those side effects don't always go throughout a person's life of being HIV positive. The side effects may tamper off. It may not be as bad. They can probably take another medicine to say if it was diarrhea. They can take another medicine to help that go away. But the effect of the medicine is much better by taking the medicine than not. Because when someone, like I said, it's for that patient to decide if they want to take the medicine, right? So if they don't want to take the HIV medicine, well, the health does decline. The immune system is not as strong. And as soon as they come in contact with someone with a simple cold, that person may have the cold, but the person who's HIV positive may, that cold can turn into a flu for them. And then it can also turn into pneumonia. So that's why the benefit of taking HIV meds as a treatment outweighs the other opportunistic infections that they can get. Another opportunistic infection, it could be cancer is a form when the immune system breaks down. Cancer could be one of the opportunistic infections. So why bear that? Why go through that? And so that's why it's great benefits on seeking the treatment. And remember, you're being followed by a doctor, so you're not out there by yourself. You have a medical case manager. Then you also have a health educator like myself. You have a licensed therapist to help support you. And then when you go into an environment, when you go to a support group, then you get your support group members to help you as well. And then your family and your friends. And so when someone tests positive, they're not alone. You're just not alone in this world. world, and people are advancing and living longer. They have a better outcome in life. They're not feeling so much stigma now. Nowadays, people know how to do things. People are clapping back at you. You say something negative, someone gonna come back and clap back at you. So just let you know there is support out there. So we're about to wind down on the show, but we still have some time. 312-738-1060. My name is Juliet Jones, and you're listening to Focus on Sexual Health, and I'm with Universal Family Connection. So, but HIV medicine does work. If a person is taking the HIV medicine, as I said, the immune system is getting stronger. And versus someone that does not, then that's where they can get the AIDS diagnosed when the CD4 or the T cells go down. They remember I said it was 600, and then at some point it could be 1,000. But then guess what? It can go back down if you're not taking medicine. It can go back down to 200, which is an AIDS diagnosis, and only a doctor can diagnose a person with AIDS. It's not just someone can't look at you and say, oh, they got AIDS. No. Or it could be 600 with pneumonia, which is called an opportunistic infection. It could be kidney disease, hepatitis. Those are AIDS-related illnesses that can put a person at risk. So that's why medication is so important. Treatment is important. So, as we wind down, once again, I'm Juliet Jones, and I'm with Universal Family Connection. And we're talking about HIV treatment and the importance of. And as I said, medicine is advancing. And I like to think it even better. People's lifestyle is advancing. Not only are you just going to be taking HIV meds, you're going to be taking vitamins, you're going to be exercising, eating healthy. Nutrition is always number one, always 100%. And some people believe in immune therapy, so there's different ways of doing immune therapy, which gets quite expensive, so I'm not going to kid you on that. But you always seek the questions, and the help from your doctor. So it's always important. And there's barriers to taking medicine. It's not just easy. I'm going to take medicine every day. That's easy. No, it's not easy. But everything is a working process. Everything, and when you're determined and to live your best life, then that's the person that's going to take their medicine every day. That's the person that's going to say, I want to live longer with HIV. I want to live. And so that's why treatment is so important. So we can't let the side effects or stigma stop you from seeking treatment. HIV is a virus. So a virus, there's no cure. And you probably heard of different advances. You probably heard of, how they say, there was a Berlin patient. He was able to do the take one cell from another person and implant it. All that is money. So all that costs money. And will your insurance cover that? No, but insurance does cover HIV medicines now. And then if a person didn't have insurance, they have pharmaceutical assistance that can help with the HIV medicines. Or co-pays, I did a lot of advocacy myself to do away with co-pays, so that won't be an excuse for a person to say, well, I can't afford my HIV medicines, because I have lobbied in Springfield and Washington, D.C., and many other advocates that I know to ensure that someone who tests positive today have the treatment. So I want to thank you all for watching Focus on Sexual Health. And I'm Juliet Jones with Universal Family Connection. And I just want to take you back to our website. Oh, it didn't work. Oh, here it is. I'm sorry. Universal Family Connection. Thank you very much. So it's important. So good night. Thank you.